Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. So a webinar where we're going to talk about Lyme disease, probably a little bit of COVID thrown in, and whatever else you want to talk about tonight. You create these webinars with your questions, so I'm very interested in seeing what you have in store for me tonight. Hopefully something interesting, and hopefully I learn a few things, and you do along the way too. For those of you that are new to this webinar, welcome here. And the way that you participate is you can listen to responses I give to the questions. And I'll read those questions out loud. So especially so those that aren't in the live version can actually know what those questions are about. Because you are participating in the live version, if you're here right now, you'll actually get to see the questions posted on your screen. They'll read at the bottom of your screen. But you can write your questions by writing them in that chat box below. The only thing I ask when you write your question is that you try to keep it short. This forum does not work out well for your life story questions, okay? It just doesn't work that way. And then the other thing that I ask is do not hit the enter key until your whole question is done. If you're trying to use your enter key to create paragraphs, it actually sends separate questions my direction, which gets really hard to follow from this side. Again, during the webinar, for those of you that are participating live, you're going to be able to see the questions. I'll post them on the bottom of the screen for you. Tomorrow morning, you will get an email from me announcing that there's a webinar next week, and you'll have an opportunity in that email to sign up for the next webinar. But also in that webinar will be links to the recording page where I will post an edited version of the recording. It's just minor edits I need to do usually. And we'll get that out to you. I plan to get that out to you before around 9 or 9:30 a.m. in the morning, okay? So just so you know, I've redone this webinar platform that I use, and you now have an option of either leaving a chat message or a Q&A message for me. I literally am going to have to hop between the two windows. I tried to set it up earlier so you could only leave one or the other, but you can't. So I'm going to have to go to two different screens. And as much as I can, I'll be trying to take these in the order they came in. Usually I'm not able to get through all the questions. So just be aware of that as well too. Okay. All right. So let's go ahead and get started here with the first question. And this is a question from S. Hi, S. Let's see. If crawling sensations appear on certain parts of the body, for example, the head, does it mean that Lyme, Bartonella bugs have moved to that part of the body specifically? Also, as far as fatigue is concerned, what do you make of very heavy, tired, pulling type feeling in the chest, heart area, especially when someone tries to jump? All right. So in terms of where Bartonella is, when you get a Bartonella infection, it's all over. And Lyme is all over too. I mean, everyone, even if you don't think you have quote unquote neuro-Lyme, for instance, Lyme crosses over into the brain. Usually I think it's within 30 minutes of actually getting your tick bite. So it's everywhere. Your Bartonella is everywhere. It's in every tissues. And so the symptoms you're having, that crawling sensation though, is a neurologic symptom. A neuropathy symptom. So symptoms of neuropathy or neurologic inflammation triggered by infections or triggered by toxins can have the qualities of sharp, stabbing, burning, shooting, piercing, electric. Crawling is one of those sensations as well too. So that's a neurologic symptom. And we know that Bartonella can give neuropathies. We know that Lyme can give neuropathies as well too. Okay. In terms of that pulling sensation, I would need to ask you a number of questions to help get to the bottom of that. So I'm not going to be able to answer that part of your question. All right. All right. Good luck to you, S. All right. Hello, Lynn. Let's see here. Hi, Dr. Ross. You recently recommended starting glucosamine sulfate 500 milligrams 3 times a day for joint degeneration. I've been taking cosamine DS, which has 15 milligrams of glucosamine and 1,200 milligrams of chondroitin sulfate. Is glucosamine sulfate better? If so, how come? Could I take both if I'm reluctant to stop taking the one I have, which has been working somewhat, want to see if the new one can improve upon it? Do you recommend also anything else for joint tissue repair for the pain caused by joint degeneration? Okay, so I have a better sense based on science and based upon my clinical experience that when you're trying to repair joint injury to the cartilage, which is what happens when you have degenerative joints. You have wearing down of the cartilage in a joint, and then let me start over. So what happens in degenerative joint disease is you have your bones come together in a joint, okay, and they touch up against each other, but they actually don't. What happens is the surface of those bones are covered in a layer of cartilage, okay, and the cartilage makes it so that these bones can glide over each other easily because it's smooth. But cartilage is also soft and spongy, so it kind of acts as a shock absorber as well too. Now, cartilage is softer than the bone it covers, and so it can wear down over time. Or if you have Lyme, Lyme may try to burrow itself in the cartilage, and to do that, it releases enzymes that allows it to burrow in, and that those enzymes can break down the cartilage as well too. What gives you pain with the degenerative joint disease is you wear down parts of the cartilage, and you wind up getting bone rubbing on bone. That bone gets inflamed. And that's what gives you the pain, okay? So there's 2 steps to helping with that. Number 1, try to repair the cartilage. And what I have found works best is glucosamine sulfate. I don't find that chondroitin necessarily helps. I don't think it'll hurt. So if you want to keep using your combination product, that's fine. And what I usually recommend people do is once they run out of their combination product, just change over to a pure glucosamine product. I don't think you need to be paying for the chondroitin that's in there. Now, I know I think it was at one of my December webinars, I recommended the product I like to use for glucosamine is the Thorne product because I trust the brand and I see good results. And that's Thorne is a good manufacturer. They do a great job of choosing quality ingredients, pure ingredients, and they encapsulate them as low allergen parts as well too. So you don't have to worry about having allergy reactions usually to their products. And I like the Thorne product. So what my comment was, I believe it was in December when I talked about it, is if you're going to try to see if glucosamine is going to help the pain from degenerative disease, you need to give it at least 3 months. That was the first part, okay? Second thing is make sure if you're doing this as a trial to see if it's going to help that you use a good product, okay? So don't use garbage to figure out if it's going to help you. Use good quality, all right? So the quality product I recommended was the Thorne glucosamine sulfate. It's 500 milligram pill, and you would take it 3 times a day, okay? All right, now, are you going to hurt yourself taking the chondroitin? I don't think so. I've just never found it to be helpful, to be honest with you, okay? All right. Second thing to do when you have pain from degenerative joint disease, from wearing down cartilage in that joint, is you want to get the inflammation down in the bone, all right? So, the glucosamine's covering that bone, so hopefully you stop having bone rub on bone, but the other thing you do is get the inflammation down. And what I like using curcumin. Now, many of you know I recommend curcumin as part of the Lyme germ treatment and your Bartonella treatment and your Babesia treatment, because in those disorders, one of the reasons you have a lot of inflammation and pain in your body and brain fog and all the symptoms we have of Lyme are due to your white blood cells making too many inflammatory chemicals called cytokines, okay? And so as part of your treatment, I try to have people regulate their cytokines, make it so you don't have as many of them. And what is useful at regulating inflammatory cytokines and inflammation in general is curcumin. And so curcumin is a component of turmeric, and it's the active ingredient in turmeric, actually. And it gets inside white blood cells and tells them to stop making cytokines, basically. It interrupts the production line, okay? But is just broadly useful for inflammation in general, too. And so I like to have people take 500 milligrams 3 times a day. And for this, you got to be careful with your products. On both turmeric, which curcumin comes from, and curcumin are actually pretty poorly absorbed unless they're prepared to be absorbed out of your stomach into your bloodstream. And so I like using a liposomal formulation, meaning it's microscopically wrapped in fat. And Thorne makes a product called Mariva 500 SF, which is a liposomal curcumin product. And that would be 500 milligrams 3 times a day, okay? So when you have joint inflammation and pain due to degenerative disease, there's 2 parts to fixing it. Number 1, repair the cartilage. That's what the glucosamine sulfate does. Number 2, get the inflammation down. That's what the curcumin does, okay? All right. Good luck to you, Lynn. Hello, Patsy. Happy New Year, Dr. Ross. I hope you are fully recovered from COVID. I'll tell you about that in a minute. Let's see. Can you please tell us your experience with getting COVID and treating it? Thank you. Oh, all right. Well, I'll tell you about it then. So, I am fully vaccinated, fully boosted, and I strongly advocate it for anyone. And I want to talk about how I kind of got it then. All right, and I want to talk about the role of the vaccine in this whole thing. All right, so. Unbeknownst to me and many of us in Seattle, Omicron arrived here a couple weeks ago, and we knew it was here, but we all thought it was like just barely out there at all. Okay. So the thing about Omicron compared to Delta is it is highly infectious. Okay. So I want to talk about the role of the vaccine. As I said, I am boosted. In fact, I was just boosted 3 weeks before I got it. So my immune system was ready to handle it. Okay. So what does the vaccine do? Well, the vaccine does not prevent you from getting infected. All right. So I like using a house and a porch analogy. All right. So your front porch is your nose. All right. It's where the germs arrive. If you breathe in COVID, you're breathing in through here. Okay. The vaccine boosts your immune system on the other side of the front door. Okay. The vaccine get your army ready to blast away if those COVID intruders get through the front door. All right. All right. So the way with this Omicron is highly infectious as this Omicron is. The way to keep from having a problem with it is not only getting the vaccine, because all the vaccine's going to do is keep you from having a bad time. And it did. It kept me from having a bad time. And I'll tell you about my time here in a minute. Okay. But the vaccine doesn't prevent you from getting infected, especially with this highly infectious Omicron. All right. So I wrote an article about this. I think some of you are familiar with that. And I said a few things in there. But one of the things I said is because Omicron is so infectious, you've got to up your game, your mask plan game. Okay. All right. So, the purpose of masking is to keep the intruders off your front porch. All right. That's what masking does. All right. But this thing is so infectious, it will blow by your surgical mask. It'll blow by your cloth. Definitely will blow by your cloth mask. All right. So you've got to up your game plan. And so this is my new mask. This is what I wear. But even after I've had it, I'm still wearing this thing. This is my N95 mask. All right. Get either an N95 or a KN95 mask and wear it when you're around others. When you're out shopping, when you're out walking in crowded streets, if you happen to live in New York City, this is the way to keep the intruders off your front porch, okay? Cloth masks look great, but they're more like window dressing these days. They may make you feel good, but the reality is this thing can get through it, okay? So how did I get it? And this will explain why I said it can get through the mask too. So I went to a birthday party. But it was a big birthday party. It was a birthday party of 85 people. And, the way I've been living through the pandemic is I'm vaccinated and I do take risk, but I take educated risk. And so this event, I took an educated risk. I did not know that Omicron was here to the extent it was. If I had, I would have never gone to this birthday party. Okay. We knew there were a few cases in Seattle. We didn't know there were a lot of cases in Seattle. All right. But this event required everyone to be fully vaccinated and or to have taken a rapid test to get in the front door, and you had to be negative on your rapid test. So, pretty low risk. I mean, people were all vaccinated or they had to test negative. Okay, but it looks like somebody did bring it in, and it became a super spreader event. Just about everybody that I know that was at that party got COVID out of it. All right. In fact, there were 2 people I knew that were there that kept their cloth mask on the whole time, and they got it. And they were both fully vaccinated and boosted as well, too. Okay. So to those people out there that are not vaccinated fully, get vaccinated fully and boosted, because I consider fully vaccinated to be boosted these days. Okay. Because you want to be able to deal with this, especially Omicron. It's out there. I mean, if it isn't in your town yet, it's going to be there and it's going to go crazy. It's going crazy here in Seattle. Florida right now, Miami, I think has got 525 cases per 100,000 citizens right now, new cases. That's what they're getting down there. That's the most infectious place is Miami right now. New York City, Washington, D.C. are disasters in terms of how this thing is spreading. It's going to spread, okay? So if you do get it because your mask doesn't work, or you refuse to mask, you want to be able to have your army ready to handle it, okay? And that's what happened with me. So I'm a person that when I get things, I tend to have strong reactions right away, and then I get over them fast, okay? And so within 2 days of this exposure that I had, I got symptoms. I woke up one morning feeling achy, having a stuffy nose and a cough. And I knew. I knew. I thought, oh God, I bet this is COVID. I bet it's from that party. And so I started isolating myself, threw my N95 mask on, got in my car, drove over to my testing center and got my PCR test done. And it took 2 days for me to get it back, but it came back positive. I knew it was going to come back positive. I had done a rapid antigen test on that Monday too, and it came back positive too. So my course was pretty good. I basically had some coughing, runny nose, fatigue, body aches for about 2 days. Cough went away after a couple days. But what I'm still left with is just a lot of fatigue. Other than that, coughing is doing well. I still have a stuffy nose that is just gradually getting better day by day. And so that's about 3 weeks ago now. I think this all happened to me. So, I'm doing okay. I'm just tired. And that's the predominant symptom I hear of people that go through this is it's the fatigue, and it takes time for it to lift. Okay. So what did I do? Well, I masked. When I started going out in public after I could come out of my isolation period, I use an N95 mask just in case I might still be infectious. I don't think I am, but so I do an N95 in public. The other things that I did is that I am always on vitamin D, because vitamin D improves your ability to handle any kind of respiratory virus, even cold infections, for instance. Okay. So part of my normal program of self-care is to do vitamin D, 5,000 international units a day. And that may shorten the course of any viral infection, including COVID. Okay. So that's one thing I do. Second thing that I'm very much aware of is the reason that people get into trouble with COVID and could get into trouble with COVID is due to the cytokine surge, your immune system's handling of the infection, creating too many cytokines, which leads to that bad respiratory pneumonia outcome that people get. And usually that type of pneumonia that you get we think is partly due to excess cytokines. That's about day 7 to day 10 of your infection. So I did everything I could to limit cytokines, and well, 2 things I should say. So those 2 things were curcumin, as I told you about earlier, my Thorne Mariva 500, 1 pill 3 times a day. And then I also used liposomal glutathione, and for that I like using the product recommended by that I recommend for research nutritionals called Trifortify Orange, which is a 550 milligram. I think it's 550 milligrams per teaspoon. I did a teaspoon twice a day. Okay. Now, the other thing I could have done, but I didn't because I didn't have it on hand, is I might have added in some quercetin and zinc. And the reason I would add in a quercetin and a zinc is quercetin also helps lower cytokines, and it's 500 milligrams 3 times a day. But it also, what it does is it helps zinc get inside your white blood cells, and zinc may have a role at blocking virus replication. And I said may, okay? And so if I had had both of those at home, and I didn't, I probably would have used those too, and I would have been doing 500 milligrams 3 times a day of that. And then the zinc I would have been doing as a zinc picolinate, and I would have done it as 30 milligrams 1 time a day, okay? So my own self-care was rest. And my own self-care was, before I got sick, I was boosted. All right. And then after I got it, I wanted to take every opportunity I could to limit cytokine storm from happening. So that was curcumin and glutathione. Okay. And I think there's some good scientific reasons to do it. But I would say with any of these herbal recommendations I have, they have not had good studies done in COVID to know for sure if they work. But there's good reasons to think they should help you, okay? Now, no, I did not prescribe ivermectin to myself, okay? I know there are some people in my network of people that know about ivermectin where they go, yeah, I bet you prescribed ivermectin to yourself. I said, nope, I don't believe in this stuff. I really don't. I know there's a group of people out there that are strong ivermectin advocates, but as I look at the science, I think it's really shoddy science. Some of the science says it may work, but you have to look at who did the science and what their biases were when they did the science. And so the outcome of the science is extremely skewed based on their opinion going in already that it was going to work. And so it's crap science, basically. So no, I did not prescribe ivermectin to myself either. Okay. All right. All right. Thanks, Patsy. That's my story. I'm doing well, just a little fatigued, a little bit of snottiness going on up here still, but it's gradually getting better. All right. Take care. Thank you. Hello, Rich. Let's see. I've been taking integrated therapeutics phytostan for intestinal yeast. I also have a product by Thorne called SF772 that I have heard is even more potent to treat candida. It contains 10-undecanoic acid. I can never say that one, by the way. Can you go over this product compared to the phytostan? Also, is it okay to be taking Thorne SacroB when you are taking other products that kill yeast? Okay, so everyone, SacroB is also known as Saccharomyces boulardii. Okay, and Saccharomyces boulardii is a healthy yeast that lives in our intestines, which is different than an unhealthy yeast, which is Candida albicans, or when we say somebody has yeast overgrowth in the intestines, we're talking about them having too much Candida. Okay, all right. But SacroB is another fungus that's very healthy, helps the intestines work well. One of its really useful functions is in people, it helps prevent from getting an overgrowth infection in your intestines that you get when you're on antibiotics called Clostridia difficile. All right. If you happen, so C. diff or Clostridia difficile is a bacteria that normally lives in our intestines, but sometimes when you're on antibiotics, it grows too much. I know that doesn't make sense, but it's a bacteria that will grow too much when you're on antibiotics. And it releases a toxin that gives you loose, watery diarrhea, basically, okay? And there's been studies showing that SacroB can actually help treat it, and it can help prevent it. So for some of my patients that are prone to having problems like that, during their treatments, if they've had a C. difficile infection in the past, I usually am going to have them take SacroB as part of their treatment to prevent getting C. difficile again. And it would be 2 pills 1 time a day. And the Thorne product is what I use. It's called Thorne SacroB. Okay. Now, you raise a good point. Because it's a fungus, should you take it at the same time that you take your phytostan or your Karuna Capri Plus, which is another product I like to use, or the SF772? I would try to separate them. So if you're, for those products, you're probably taking them twice a day. I would take them in the morning, at night, and then take your SacroB sometime in the middle of the day. So you're not taking it directly at the same moment, basically. Okay. All right. Now, my own experience is the SF772, which is a single drug, if you will, or a single herb product, does not do as well as multi-herb products in the majority of people. Okay. So your phytostan is a multi-herb product. And so what it's got in it, and I'm going to do this off the top of my head, but it's got caprylic acid, powder co, it's got some of the endocyaninic acid in it as well, and it's got some rosemary and thyme oil in it. I think those are the big components of phytostan, okay? I tend to like its effect better than the SF772 alone. If I want to go something stronger, what I like using, what I think is stronger that I use in my practice and is available, because right now phytostan, which is an integrative therapeutics product, seems to be in short supply. In fact, I can't even get it right now. It's out of stock permanently. Well, hopefully not permanently, but right now it's been out for quite a while. The alternative that I offer at my supplement store is a product by a company called Karuna, and that's Karuna. And their product is called Capri Plus, and it's a combination of caprylic acid, oregano oil, and garlic. I find that stronger, actually, than the phytostan product. So that also is a 2 pills twice a day. All right. All right. Let's see. I think I've answered your question there. Thanks for your question, Rich. Hello, Bill. Let's see. Hello, Dr. Ross. My family doctor has me monitoring my blood pressure at home. It is usually in the 120 to 135 over 70 to 80 during the day. I notice when I check it when I am laying down horizontal, it is often 140 to 160 over 70 to 80, Then after standing, it goes back to normal. And I can repeat that finding when I lay back down. I never thought I had POTS, as I never get lightheaded. I do have an arrhythmia that has been attributed to vagal nerve dysfunction. I am thinking the blood pressure lability might be related to the vagal nerve issues. Which pathogen do you usually see this with? Do you ever see vagal nerve issues improve if properly treated? I'm also seeing elevated intraocular pressures when in the supine position that does not respond to the usual topical treatments. Has the ophthalmologist stumped? Could this be related to blood pressure issues? Thank you. So I'm not, with the increased intraocular pressures, I am not aware of a relationship with Lyme and co-infections. Okay, so I just say that. And I'm not aware that it's related to the blood pressure either. I mean, I would say I'm stumped by that one too. In terms of having some vagal dysfunction, whether you have enough to call it POTS or not, I don't know. But I mean, you have some variance there. So everyone, the vagal nerve is a nerve that comes out of the base of the skull, right about here. It's called cranial nerve number 10, or the vagal nerve. And it's what regulates your adrenaline and anti-adrenaline, basically, okay? And so it controls your heart rate, your blood pressure, how your digestion works, the function of all your organs in your body. That's under the control of the vagal nerve. And it can get infected. And the germs that can be involved in causing it to dysfunction is Lyme, Bartonella sometimes, and Babesia. Those three can lead to some vagal nerve dysfunction. So to answer your question, it would be either one, any of those three. All right. All right. Thanks, Bill. Good luck. All right. Let me go over. I've got this other. Remember, I said there's a board that is just questions too. So on a Q&A board. So I just flipped over to that one. So hold on here just a minute. All right, so this is from Dave. Let's see. Hi, Dave. Let's see. Hi, Dr. Ross. Do mold binders like activated charcoal or cholestyramine bind the COVID vaccine as well? Do binders lower the efficacy of the vaccine? I am waiting until I receive my second shot of Pfizer before I begin taking activated charcoal to treat trichosethine. Just concerned the binder will bind the mold and the vaccine as well. Thank you. So no, there should be no binding of the vaccine by the binder. So those binders only bind toxins that are in the gut. They're not binding anything else throughout your body. Okay, so with mold toxicity, let me talk about why we use binders and as part of explaining this. All right, so 25% of all people, according to work by a physician named Richie Shoemaker, have a genetic predisposition to not being able to remove mold toxins once they breathe them in. All right. So what happens in 75% of people, where everything is working correctly, is you go into a building that has a lot of mold in it, and there's mold toxins, a quiet cloud you can't see, and you breathe in this cloud of toxins. And they get absorbed in through the lungs into your bloodstream. And in the bloodstream, some of your white blood cells will see these toxins, and they'll tag them. Okay, they're tagging them to be removed. And then other white blood cells will come in and break those toxins down, okay? And they're done. You don't have any problem with them. That's what happens in 75% of us. Now, in 25% of us, that doesn't happen. And in 25% of us, what goes on is these toxins, we breathe them in, they get into our blood, but there's no white blood cells that tag them. They're not recognized by those white blood cells. And so they then go to the liver. The liver's job is to try to remove fat-based toxins like mold toxins, okay? And the way the liver tries to remove fat-based toxins is there's a bunch of chemical reactions that they do that tries to make these so that they attach what is known as a water-soluble group onto the toxin. So they try to make it so it's not fat-based anymore, but now water-soluble. And then once those chemicals have been put on the toxins, they're supposed to move out into the intestines. And because they're water-soluble, they mix in our poop and we poop them out. That's what's supposed to happen, okay? But the second problem that happens in mold toxicity is it's one of those toxins that the liver can't handle either. So the liver does not transform them into a water-soluble form. The liver still processes them, and they still come out as a fat-soluble mold toxin. They go to the gallbladder and then through the bile system, and they get moved out into the intestines, okay? But because they're fat-soluble, they get reabsorbed right back into the bloodstream again, okay? So where your binder is working is out there in the intestines, grabbing onto those toxins so they don't get reabsorbed again. Those binders do not get absorbed into your body. They stay in the intestines, okay? So they should have no interference with your vaccine at all. All right. Thanks, Dave. Good luck to you. Oops, looks like we answered that. As you asked it in two different places here. Oh, Jim, you've asked me about my COVID, and I already went through that, so let me get rid of that. Hello, Kate. Let's see. What do you recommend for the trauma associated with chronic illness? I'm healed, but I feel stuck in the process of it all. So in that kind of a situation, there's two things you might want to consider. One, get a good counselor. Get a counselor that has some familiarity with chronic illness and can help you look at and examine some of the issues you continue to face. And some of it, people that go through this disorder can develop post-traumatic stress disorder, for instance. All right. Because it is quite a trauma to go through chronic illness like this. So find a skilled counselor that can help you explore that and look at it. Okay, so that's one thing. Second thing that sometimes happens when people go through these illnesses is that they develop, I guess, what I would call a neurologic holding of the illness. And this, especially these illnesses can create a lot of hyperreactivity within what is known as the limbic system. And the limbic system is involved in your adrenaline management and anti-adrenaline management too, okay? So there are a number of programs out there that help address that. These are programs that help you look at how you react to stresses in the world and your emotions and help give you some tools to deal with that, okay? And so I'm blanking on the name of the more common program for that. I'm sure it'll come to me. There's one of the programs, it's a Gupta program is one of the programs. Kate, I'm sorry. I am really just blanking. When it comes to me later, and it will, I'll pop back up and tell you what it is. Okay. I'm just making a note to myself here. All right. Actually, look, yeah, it'll come to me. Sorry about that, Kate. I'm blanking on. There's one that's really a common one that people in the Lyme world use, and I'm just blanking on it right now. Anyhow, it'll come. It'll come. All right. Thank you. Hello, Adrian. Let's see. Thank you, Dr. Ross, for all you do. You're welcome. I'm following up on my question from December's Q&A where I asked about cause treatment of severe abdominal pain with tick-borne illnesses. I have already been under the care of a GI specialist and the following completed: endoscopy, colonoscopy, abdominal CAT scan, abdominal ultrasound. All of these tests were normal. My stomach pain worsens during Herxheimer reactions. How would you recommend getting to the bottom of severe abdominal pain? Thanks again. So Adrian, we think, you've done a thorough exam, okay? And so my first thing would have been is to get a GI specialist to look in your intestines, do the endoscopy, do the colonoscopy, get an abdominal CAT scan, and get the abdominal ultrasound, okay? Now, and I'm glad to hear those are all normal. That doesn't mean you're still not having pain. We think in the world of Lyme that one of the reasons that people can get abdominal pain is from inflammation within the lymph nodes that line deep up along the spine and are found within the abdominal cavity. Now, sometimes those lymph nodes will actually be enlarged and inflamed, and you can see it on a CAT scan, but yours wasn't. And sometimes you might even see them on the ultrasound, but yours wasn't, okay? We tend to see this abdominal pain for which we cannot find an anatomic reason with all these studies. We tend to see it in people that have Bartonella. And we think it has to do with inflammation within the lymphatic system and the lymph nodes, okay? So I don't have another test for you to do. My approach, usually when I see somebody like this, is to make sure that my regimen is covering for Bartonella. Even if testing is negative, in a situation like this, I would make sure that my antibiotic regimen is covering for Bartonella so that you're knocking the germs down. The other thing you want to do is control inflammation. And again, as you all know, one of my ways I like to do that is to try to lower cytokine inflammation. Again, your white blood cells, when they're trying to deal with these infections, manufacture chemicals called cytokines. They're good in that they turn the immune system on. But if your immune system is having a hard time getting rid of Lyme or getting rid of mold toxins or getting rid of yeast in your intestines, it's going to manufacture too many cytokines. And too many cytokines give you fatigue, make it so you can't think, give you body pain, give you inflammation, make it so you can't sleep, etc. I mean, what we call Lyme symptoms are actually too many cytokine symptoms, okay? Now, when you start killing germs, the immune system sees the dead germ parts and makes more cytokines, okay? So yeah, the fact that this is getting worse when you as part of a Herx reaction from what you're describing could suggest that this is due to cytokines. And so for that, what I would definitely want to do is make sure you're doing curcumin. As I said earlier, the Thorn Mariva 500 product, 1 pill 3 times a day. You might also want to work with some glutathione. So what the curcumin does is it gets inside your white blood cells and limits their production ability of the cytokines. Glutathione interferes with the signals going on that tell your white blood cells to make cytokines. So glutathione helps lower cytokines that can lead glutathione lowers oxidizing agents that are telling your white blood cells to make cytokines. So in addition to doing the Thorn Mariva 500 curcumin 3 times a day, you might add in the Tri-Fortify orange or Tri-Fortify watermelon, which is the glutathione product by Research Nutritionals. You might do 1 teaspoon once or 1 teaspoon twice a day. Okay? All right. Good luck to you. Hello, Ruth. Let's see. Thanks for informing everyone throughout North America with your fantastic webinars. You're welcome. Actually, I have people that participate even in Europe, although it's a little bit late for them, but they do. So yeah, but thank you. Let's see. Double vaxxed with Moderna. Lyme confirmed by Igenics in 2016. Allergy type symptoms worsening. Just started taking zinc and N-acetylcysteine. Seems to help with sore muscles and found sensitivities, etc. Still have swollen lymph nodes for 2 weeks. Is this Lyme or COVID? Thank you. Well, it's hard for me to say. I mean, the thing to get the answer to the COVID is get a COVID test. Beyond that, I would need to ask you a lot more questions. But the COVID is something you can test for. You can either do a rapid test, which will find it if you are infectious with it, 90%, about 98% of the time, or get the PCR test, a nasal test, to find out, is it? Okay. All right. Good luck to you, Ruth. Hello, Matthias. Let's see. Hi, Dr. Ross. Let's see. I've taken flagyl 4 times now, always with a couple months in between and only for a couple days. The last time I got tinnitus for a couple hours, and afterwards I experienced diminished hearing in my left ear. A half year later, I am still thinking I am hearing less well. The flagyl always helped me a lot, so my question is, would it be risky to try it again, given that 3 out of 4 experiences were fine, or is it too dangerous? How do we know what is drug side effect or Lyme Herx's or damage? You know, that ultimately that's going to be a question for you to explore with your physician. Okay, so anything I say here is something you should talk to your doctor about, because I don't know your full medical history here as well, too. All right, but in my practice, I do not see that flagyl leads to tinnitus in people. All right, I'm not sure why it happened that one time with you. It could be flagyl related, and it may not be. one option you might want to consider is, instead of using flagyl, would be to use a different drug in the same family. So flagyl, the generic name is metronidazole. Other members of that family are, another one is tinnitusol, but also all of your antifungal drugs like fluconazole, voriconazole, itraconazole. How they all end in azole. Those last three I just told you about are fungal medicines, okay? So there's some reason to believe that if flagyl is working to treat cyst Lyme, and that's why you would use it, probably any of the azoles will work. And so I and a number of my colleagues, instead of using flagyl, might use a fluconazole, which is a diflucan, as an alternative, okay? Tends to be a lot more tolerated too. The other option of a drug that is more similar, in the same family, but more closely related to flagyl, would be to do tinnitusol. And just because you had a reaction to the flagyl, metronidazole, does not mean you would to these other ones, all right? So you might want to look at an alternative, all right? But again, talk it over with your physician, okay? All right. Good luck to you. Hello, Diane. Hold on here, everyone. All right, let's see. First time tick bite for a friend. Oh, hi, Diane, by the way. Let's see. First time tick bite for a friend. What should she do if there is a piece of the tick embedded after pulling it out? Is there a danger of leaving it in, or how do you get it out? She's taking 100 milligrams of doxy 2 times a day for 3 weeks. Any other recommendations? Any other meds? Thank you. So she's doing the right thing. I would do doxycycline as she is doing for 3 to 4 weeks. All right. In terms of that tick head that's left embedded, there's no danger in leaving it in. And what will eventually happen is her body's immune system will break it down. So I wouldn't get carried away trying to have it cut out or anything like that. It will eventually be absorbed by the body's immune system, and it is not serving as a source of infection at this point, especially if she's on doxycycline. Okay? All right. Good luck, Diane. Good luck to your friend. Hello, Eileen. Thanks for all you do for us. Is Lyme misdiagnosed as ALS? Thanks again. So, sometimes it is, or we get into a semantics issue. So let me try to explain some things here. So in neurology, the field of neurology, neurology is good at describing conditions or syndromes and identifying the architecture, the biologic thing that's going on, or the architecture, what it looks like. But is neurology as a field is not good at saying what the cause of something is, okay? So for instance, neurology has certain standards that they would use to say you have multiple sclerosis. And that's based on your symptoms, but predominantly these days is based upon whether you have lesions that show up in the architecture of your brain or your spinal cord that we see with an MRI, all right? So multiple sclerosis is a neurologic construct, but it doesn't say what causes it. And there may be multiple causes of it, of which for some people, their Lyme gives them multiple sclerosis, all right? Now, in those people with Lyme and multiple sclerosis, I would say they have Lyme giving them multiple sclerosis. I would also say they have Lyme and multiple sclerosis. But in my notes, I would say, I think the multiple sclerosis is caused by Lyme. Okay, all right. Same thing with ALS. ALS is a finding where you have problems that develop in the nerve roots, basically, all right? And the way that it's ultimately diagnosed is there's findings that you'll see on something called an EMG study that neurologists do. And if they see these findings and you have certain symptoms, they call it ALS, all right? Now, ALS may have multiple causes, of which a cause for some people is Lyme disease. Now, I would, in that situation, say they have Lyme and they have ALS. And I would say they have Lyme causing their ALS, for instance, okay? So there are multiple other reasons for ALS. So not everyone with ALS has Lyme, okay? All right. I hope that helps you look at that. Thanks, Eileen. Let's see, recover energy after COVID. So as, I guess there's two parts here. That was part one. And here's your second part, which is really your longer question, it looks like. Hi, Dr. Ross. I had all COVID symptoms, but my 6 rapids and 2 PCRs were negative. I lost my smell and taste for 4 days, but I'm not sure if that's just because I was stuffy or because it was a viral infection. How can you know what it is? Oh boy. And then you have a second question about getting energy back. Okay, so there's a small subset of people that the PCRs and the rapid tests will not pick it up. But that losing smell or losing taste is so specific for COVID that if you had a lot of symptoms of a cough, temperature, stuffy nose, and you lost your ability to smell or taste, I would call that clinically COVID, okay? There is no other way to tell for sure, though. You failed most of the test if you have it, and there's a small subset of people that they will not test positive for COVID that could still have it, okay? All right, so I would say, yeah, you probably, especially if you did lose your smell and taste, both of those, like really lost them, not just like it was kind of gone, but like really lost them, that's COVID. I would call it COVID, okay? All right. Now, obviously, talk it over with your own physician, too. I don't know your full story, but I would call that COVID from what you just told me here, okay? Now, I think you had a second part to your question, which is recover energy after COVID. And so there are people that get COVID, as many of you know, that develop what is known as long-haul COVID. And that could be low energy. It could be brain fog. It may be still some cough symptoms. And so this would be people that probably a month or more outside of the infection are still having problems, basically, okay? So there's a number of theories still as to what's happening with that, but we don't fully know. One of the theories is that when you get COVID, this spike protein, that the vaccine is also made against, or the vaccine is supposed to cause a reaction against the spike protein. The concern with the infection is that your white blood cells, your monocyte, a type of white blood cells called monocytes, may have difficulty getting rid of the spike protein. They eventually do. It looks like it's months down the road in some people, but it may be a process and take time for that spike protein to go away, okay? And so when you have this in the monocytes, and the monocytes are producing a lot of extra cytokines, and it's those cytokines that lead to your ongoing fatigue, basically. So one of the things that I like doing with my patients that are having energy problems after COVID, there's a few things. Number one, I like to work on getting cytokines down. And I like working with curcumin, that Thorn-Reva 500 I told you about tonight, 1 pill 3 times a day. I also like to get people on glutathione. And I like using liposomal glutathione. And the reason I use liposomal is that glutathione on its own is not well absorbed. But if you microscopically wrap it in fat, it will be absorbed a lot better. And the product I like for that is the Research Nutritionals product called Trifortify. Okay. And I would do 1 teaspoon once or twice a day. Right. The other thing I would do is I would pull from an idea that's found within Ayurvedic and Chinese medicine, which is to put somebody on an herb that would be considered to be an adaptogen, something that helps their body deal with stress. And what I like using is my adaptogen. There's different kinds out there, but what I prefer to use is ashwagandha. Ashwagandha is an Ayurvedic and Chinese medicine herb that's been used for thousands of years because it's been observed to give people under stress better energy, okay? If we look at animal, there aren't good human studies on it, but animal studies tell us that it helps your adrenals and your thyroid work better. All right. So I usually put somebody on ashwagandha 2, and I would do 2 pills in the morning and 2 pills between 1 and 2. All right. Finally, the last thing I would do that somebody that's really, if we're a month out or so and they're still having a lot of energy problems, I might look at doing some work to support the cell energy factories, which are called mitochondria. So one of the things that helps your mitochondria is glutathione. Glutathione's an antioxidant that helps restore damage to cells and things inside cells. Okay, that's its job. It's actually manufactured in every one of our cells, and it's the master reparative antioxidant. And if you have injury to your mitochondria or to your cells, they probably will exhaust their glutathione supply, and basically you need to fill the gas tank back up. Okay, so so being on the glutathione that I already mentioned, lower cytokines, also helps repair some of the damage to the inside of the mitochondria. And then finally, you want to repair the covering of the mitochondria. Sometimes with infections, as the body tries to get rid of those infections, whether it's bacteria, viruses, as part of getting rid of those infections, the immune system will create oxidizing agents, like hydrogen peroxide, for instance. And that hydrogen peroxide and other oxidizing agents can damage your cell membranes, and it can damage your mitochondria membranes. Your cell membranes, mitochondria membranes, are made up of a group of phospholipid fats, okay? So what you want to do is you want to repair that. So what I like using is products that contain the phospholipid fats. And I like using, the best of those that I like using is a product made by Research Nutritionals, which is called ATP 360. And I have people take 3 pills 1 time a day. Research Nutritionals has got some good science showing that you get better mitochondrial function from it, okay? And usually I'm going to use that up to about 6 months, all right? Now, there's only one group of people that should not do ATP 360. And that is if you happen to be treating Babesia at the same time and you're on a drug that includes atovaquone. So those would either be atovaquone or Mepron, which is the trade name of atovaquone, or Malarone, which is atovaquone with proquenil, or generic atovaquone with proquenil, all right? Anything with atovaquone, you should not be on coenzyme Q10. And the ATP 360, the major part of it is those phospholipid fats I was telling you about, but it also contains micronutrients that help your mitochondria run better, which one of those is coenzyme Q10, all right? So you don't want to take ATP 360 if you're on one of those Babesia meds I was just telling you about. But as an alternative, what you could do if that's your situation is instead of ATP 360, use a product by Research Nutritionals, which is called NT Factor Energy. All right. And what NT Factor has in it, it's a group of phospholipids, a different proprietary mix of them, but phospholipids, but it does not have any of that coenzyme Q10 in it. And so you would do, of the NT Factor product, you would do 2 pills 3 times a day on that one for 2 months, and then you knock it down to 1 pill 3 times a day after that. Okay. All right. I think that takes care of that. All right, Kate, good. Thanks for those questions. All right, let's go over here. Let's see, get rid of that. Hello, Ash. Ash says, hello, Ross, Dr. Ross. Hello back. Hello, Gail. Let's see. This isn't really a Lyme question, but nobody can help. I passed a 5-millimeter kidney stone in early December. As soon as I passed, I had relief, but I have been left with some cited stabbing pelvic pain and now hip pain on the same side. Can't lay on hip at all. Doesn't hurt when I walk, and I feel it is connected to pelvic pain. Pelvic pain is in the left lower quadrant. If there are no more stones and no fragments, no UTI, etc., what could be causing this pain? All GYN and GI causes were ruled out. Urologist says no way from the stone. Residual pain can't last this long, but I'm 100% sure that the stone is what triggered it. Any ideas? Nobody can ever seem to think outside the box or have any ideas about the source of the pain. Also, is typical DMSO safe to use on hip or pelvic pain? I can't cope anymore. DMSO is safe. I'm not sure what's going to give you relief here. So Gail, I'm sorry to hear what's going on with you. It's maddening to have something for which there's not a defined cause. I mean, as you know, the world of Lyme, that's what we all experience on a regular basis anyhow, but you're even in a different way, you're experiencing it here. When I see a situation like this where there is not a definable anatomical cause, I'm going to start wondering about energetic causes, okay? And the system of medicine that is very useful at dealing with these kind of things would be Chinese medicine and acupuncture, or Japanese style acupuncture. My preference for acupuncture is to do Japanese over Chinese style. And the reason is I hate needles. And in Japanese style acupuncture, they use the same general points and the same meridians and the same theories. They just put the needle into the skin. They don't put it deep in where it hurts you as much, all right? So these are the kind of things, like when I have pains that doesn't have any explanation in Western medicine, I go see my good friend here in Seattle area, Randy Clare. He's a great acupuncturist. Usually a couple of times he has it taken care of for me. So I can't guarantee acupuncture would help you, but I definitely would consider giving that a try, because you're running into a dead end looking at anatomical causes of it. And so it's time to start thinking about energetic causes of it. And acupuncture sometimes can be very useful for that. Okay. Those would be some thoughts for you. All right. And again, if you're any of you are listening in the greater Seattle area for acupuncture, if you're wondering who I recommend, a wonderful acupuncturist in Shoreline, Washington. His name is Randy Clare. He's who I use. He's a good friend also, just to be honest about that. But I use him for the acupuncture because I've seen tons of acupuncturists and I have the best results with him. So that's who I refer my patients here to is him. Okay. All right. Thanks, Gail. Good luck to you. Hello, TJ. Let's see. Anything to improve hypothyroidism, both prescription or natural, or available without a prescription or supportive? So, TJ, there's a number of things you can do. And I'll show you the article I've written about this too, because it's got a lot of detail in it for you. Let me see. Well, I forgot to set it up. No, let me do it now. I'll set it up here. Just a minute. New window. All right, we're all set up. All right, let's see here. So, okay. So TJ, I'm going to show you an article I've written about it, and I'll point out a few things about it too. Okay. So actually, let me describe it, and then I'll show you the article. So one of the things that I like using to support the adrenals and the thyroid, because if you support the adrenals, that supports thyroid function too, is ashwagandha. I mentioned that earlier. It's an Ayurvedic Chinese medicine herb that has been shown in animal studies to help create better thyroid and adrenal function improvements in their levels, actually. Okay, and so that's ashwagandha. It's a 400 milligram pill or a 500 milligram pill, depending on who the manufacturer is, and it would be 2 pills in the morning and 2 pills between 1 and 2. Other things that can help are the nutrients selenium, and you would want to do 200 micrograms a day of selenium. Zinc, about 30 to 50 milligrams a day, may be a micronutrient that helps. And iodine, but you got to be careful with iodine. You don't want to use too much of it, because iodine can lead to your thyroid gland working sluggishly, okay? And I think you don't want to use more than 150 micrograms, that is, a day on that, but I'm going to check it out. I always have to double check that one. So let's go look at the article together here, okay? So let me do a quick screen share here. Okay, so this is my Lyme information website, and I know you're all familiar with it. And so in terms of thyroid, take a look at my, I've got an extensive article I've written about that. Take a look in my hormone section here. All right, and take a look at this article called Hypothyroidism, the Best Test, Meds and Vitamins, okay? All right, and as many of you are aware, I had some problems with my medical board over my using functional medicine and treating Lyme. And actually, this article is based on what I wrote to them, trying to tell them why I manage thyroid like I do. All right. So it's based on the science that I sent them as well, too. I talk about the standard that most doctors follow and why that doesn't work here in chronic illnesses. And then I lay out the argument for why I do what I do. So anyhow, down here, you're going to see a description all the way down. Is a section on the various vitamins you might want to use. So one of those, again, selenium, 200 micrograms a day. Zinc, I put 15 to 30 micrograms a day here. That's right. Vitamin D, you want to make sure you're getting enough of that. And then iodine, don't go over 150 micrograms a day on that, okay? One other thing that can sometimes be useful too, especially if your low thyroid is due to Hashimoto's or autoimmune thyroid illness, would be to get on low-dose naltrexone. Naltrexone is a narcotic blocker, but when we use it at low doses, it actually can regulate an immune system that's attacking you and attacking your thyroid. And I talk about that. Excuse me. I talk about it in that article then. Okay. All right. Thanks, TJ. Good luck to you. Hello, Thomas. Let's see. Are valproate or gallium nitrate effective? I've seen it mentioned quite often on some of the alternative websites. I'm not sure that they are, and it would depend on what you're using them for. So effective for what? Valproate, for instance, is an anti-seizure medicine. Yeah, that can be effective for seizures. I'm not quite sure what the gallium nitrate, and I don't know why these would be, people would be mentioning these for treatment of Lyme. Okay, so I'm not sure how to respond to that. Thanks, Thomas. All right. Hi, Mary Kay. Let's see here. Hello, Dr. Ross. I'm trying to get pregnant. Should I stop taking the Banderol Cemento I have been on? What should I switch to prevent transmission of Lyme? I'm very tiny at 110 pounds. Thanks for these webinars. Okay, so first of all, you should ultimately talk to your doctor. Okay, I'm not your doctor, and when it comes to what you should be on, not be on during pregnancy, you need to talk to your doctor. Okay, but I'll tell you what I recommend for my patients here in my practice. So up until the point that you actually get pregnant, you can remain on the Banderol Cemento. And so what I usually tell my patients to do is remain on it until they miss their first period. And even after you miss your first period, you still have about another 2 or 3 weeks before there's going to be any kind of adequate blood flow going to the developing egg and then developing fetus before you start having any chance of transmitting Lyme, or you want to definitely by 2 to 3 weeks off after you miss that first pregnancy, be off of any herbs that might harm the growing baby as well too. Okay. So, but you have time. So once you miss your first period, that's the time to stop the Banderol Cemento. All right. And then in terms of what antibiotics you can use to prevent Lyme transmission, there's 3. You can either use amoxicillin, or you can use something called cefuroxime, or you can use azithromycin, which is Zithromax. Zithromax has the advantage that if you're also trying to prevent transmission of Bartonella, which we wonder if that can be transmissible, we're not sure, but it might be, then azithromycin is the drug that will do that. The azithromycin dosing I use is 500 milligrams 1 time a day. The amoxicillin dosing I use is a 500 milligram pill, 2 pills, 3 times a day. So that's double standard dosing you would use for other infections. And then the cefuroxime, which is 500 milligrams 2 times a day. Okay, so cefuroxime 2 times a day, amoxicillin 3 times a day, azithromycin, which is Zithromax 1 time a day. All right. Now, the other thing you want to do, because those are antibiotics, they may lead to too many yeast in your intestines, is during pregnancy, I also have my patients that are on antibiotics like that take nystatin, which is a prescription anti-yeast medication, which is safe to use in pregnancy because it stays in the intestines. There is no systemic absorption at all. Okay. All right. All right. So anyhow, good luck to you. All right. Now, earlier tonight, Kate asked me a question about what to do if she still is recovering from the trauma of having Lyme. And I suggested counseling. And then I said there was another program that I would recommend to help regulate her limbic system. Remember that conversation? Okay, so the program is I told you it would come to me. The person that has the program is called Annie Hopper, and the system is called Dynamic Neural Retraining System, or DNRS. Okay, so if you Google Annie Hopper DNRS, you'll find her program. All right. So yeah, it did come to me. All right. It may take about half an hour, but it did come to me. So anyhow, Kate, that was the information I was trying to remember earlier. Okay. All right. Hello, Mary. Let's see. Hi, Dr. Ross, and Happy New Year. Happy New Year to you. Let's see. How long do you treat Bartonella before adding Babesia treatment? So, I think many of you may be aware, I usually advocate that if you have both Bartonella and Babesia, I usually, unless the Babesia is the thing that's just knocking your butt flat, that is the most detrimental part of things, I'm usually going to treat Bartonella first. And the reason that I do that is based on the observations that I learned. So a lot of my training when I first got into managing Lyme disease was things I'd learned through the International Lyme and Associated Disease Society, ILADS. And one of the big educators at that time was one of the Lyme pioneers on the East Coast named Dr. Burrascano. Some of you may know his name, but he hasn't practiced for a number of years now, so a lot of people don't know his name anymore. But he used to be one of the big guys. He's one of the pioneers at treating it. And so he was full of a lot of wisdom from things he observed in his practice. And his practice was on Long Island, and he still is out on Long Island. But his observation was that in his patients, that if they had Lyme, Babesia, and Bartonella, if he were to try to treat Babesia before going after Bartonella, it would make it harder to get rid of the Bartonella. That was his observation, okay? And he had reason to believe that. I mean, he had good history. A long time he treated the illnesses, basically. Now, but also he advocated, and like I do too, you still treat the Lyme. So you can treat Lyme and Bartonella or treat Lyme and Babesia. But at the beginning, usually what I would do in situations like this is treat Lyme and Bartonella first for at least a couple months. I want to start seeing some improvement in those Bartonella symptoms, which usually takes about 1 to 2 months in a regimen that's working, okay? And if you are starting to see improvement, then you could start adding a Babesia treatment in, even while you're wrapping up the Bartonella treatment, okay? All right. Good luck to you, Mary. Let's see. Oh, I think we already did that earlier, Adrian. Hello, Stuart. Let's see. I'm nearing the end of a 7-month treatment for chronic Lyme, as well as Babesia, Bartonella, and Ehrlichia. The treatment consists of disulfiram, dapsone, rifampin, azithromycin, amoxicillin, clavulanic acid, as well as a variety of natural foundational supplements. I'm just reading this here. So Babesia, Bartonella. So I'm just trying to see what you wrote here, if you've got everything covered. So disulfiram is going to cover you, help with Babesia. It's going to cover the persister state of Lyme. Dapsone, rifampin, azithromycin is going to treat growing Bartonella, growing Lyme, and persister Lyme and persister Bartonella. Amoxicillin is primarily Lyme. The only thing you're missing here is I wouldn't consider this a super strong Babesia treatment, although the disulfiram dapsone may go after Babesia too, but I think there's stronger things to do. Okay, that's just my observation. Okay, all right, C. And then I actually feel worse now than I did at the start of the treatment 6 months ago, but I'm hoping that's due to some of the side effects of the medications, particularly the disulfiram and dapsone. When I finish the treatment and assuming I begin to feel better, I would like to be retested to see if I still have Lyme. How long after the end of treatment do you recommend I wait before being retested, and which test method do you recommend? Okay. So first of all, the two drugs that are going to be the major causes of your side effects are disulfiram and dapsone. The dapsone, pretty much within a couple of weeks after you stop it, most of those side effects will go away. The disulfiram can take a whole month to get out of your system. All right, so just be aware of that, okay? All right, then to your question, there is not a decent test to tell if you're done with a Lyme treatment. All right, now, I know there are a number of my colleagues that go out there and try to retest so that they can feel they did the right job, okay? But the truth is there is no test that we can do that tells us we're done. All right, now let me explain why I'm saying that, okay? All right, so the methods that we have for testing for Lyme, I'll just talk about Lyme to begin with. To test for Lyme, we can either measure whether you have antibodies, your immune system is making antibodies, or we can measure whether your T white blood cells are attacking the germ, okay? That T white blood cell test is something called an ELISpot that's offered by a lab called InfectoLab, or Armin Labs in Germany does that. And the thing about that ELISpot test is your T white blood cells that fight infections will only live for 2 months. And so the thinking is if you do that test and it was positive at one time and then it becomes negative, the thinking is that your T white blood cells have not seen Lyme for at least 2 months. It must be gone. That's what the thinking is, okay? The trouble is Lyme can suppress the immune system. And so if you're not feeling better and you no longer have a positive test, it may just be that your germs are partying on, suppressing the immune system, making that test negative, okay? Same thing with the antibody test. The antibodies, once you make antibodies in Lyme, they remain. They wind up being the system that keeps you from having the germ again. And if those antibodies go away, it just may mean you got so much immune suppression that it just made it so they can't make it. The germs may be partying on, okay? And then, but also some doctors will say, well, let's measure how reactive it is, all right? And again, just because it is less reactive doesn't mean the germs are gone. It just means maybe you have a lot of immune suppression going on, all right? So there is no way of knowing if it's gone. We don't have a test for the Lyme germ that measures whether it's still in you or out of you. All of our testing is looking at immune reaction. And that immune reaction can be subject to immune suppression. So it's just not useful at all, okay? When it comes to Bartonella, the testing we have for that is either to do an ELISpot, like I just said, or to do an antibody test, or to do a PCR DNA test. Now, of those tests, the PCR DNA test would be one that would tell you whether you have living germ in you or not, okay? The other two tests, the antibody and T cell test, again, could be negative if your germs are partying on and suppress the germ, and you get a false sense that you cured it when you really have it, all right? The problem with the PCR test, though, is that you have to have the germ swimming by the needle when you draw it. Guess what? Bartonella doesn't readily live in the blood. It actually tends to live inside your cells or stuck on the side of your blood vessels. It's not really swimming by the needle when you draw it. So just because that comes back negative doesn't mean it's gone. It just may mean you missed it when you did the blood draw. All right. And I could go through a similar process with Babesia and even Ehrlichia too. So there is not a done test. Okay. Now there's a bunch of my colleagues that are starting to do done tests because they want to feel better. And they misunderstand. They're not following what the science says. There is not a test that proves you're done in this disorder, unfortunately. You got to go by what your symptoms tell you. And the only way you're really going to know is you're going to have to be off your dapsone and your disulfiram. The disulfiram, you're going to want to be off a good month before you even try to figure out where you are on that one. Okay? All right. Good luck to you, Stuart. Now, I got to admit, you'll probably go to your doctor and they'll test you because there's a lot of my colleagues out there doing it. And I don't know what they're testing for. I just totally disagree with them doing that. All right. Good luck. Hello, Brandy. Let's see. Any preference on stool tests? Are they worthwhile? Do they provide any real actionable information, or is it a waste of money for people on a budget? Should you take probiotics regardless of digestion status? So the only time, Brandy, I know it'd be really helpful to know a lot more about you, but in general, I don't stool test everyone. The people that I will wind up doing stool testing on is if I have a lot of GI dysfunction, abdominal pain, gassiness, and bloating, and I take steps to get yeast out and it's still happening, I might get a comprehensive stool digestive analysis, see if I can learn from that about what's going on with the bacteria, whether there's pancreatic function that's correct, a bunch of things you can get from the test. But to just randomly do it without symptoms and without first trying to get rid of too many yeast in the intestines, I wouldn't do it. All right? All right. Good luck to you. Thank you. Hello, Elena. Let's see. Hi, Dr. Ross. I was diagnosed with Bartonella and Lyme. In June 2021, I added the essential oregano oil into my treatment, 5 drops twice a day, taken in capsules mixed with olive oil. 1 month after, my throat began to hurt so much that I can barely speak until today. Do you think this could have something to do with the oregano oil? If it is from essential oregano oil, do you think it could be avoided by taking the liposomal oregano oil? Okay, so June 1. So I think from what you're saying, you've been having this problem now for about 4 or 5 months, right? Okay. What I can't tell is whether you're still on the oregano oil or not. All right. So let me just give you some generalities here. All right. So oregano oil is harsh. I mean, it can be harsh. All right. And so first of all, I usually like to have it. The products that I'm using for it are ones that are encapsulated so they work their way through the stomach, okay? But even so, sometimes some of that does get into the stomach. And in the stomach, it can lead to some gastritis. And some of that gastritis sometimes can lead to acid reflux going up into here, okay? So, yeah, it can sometimes lead to burning sensations here, burning sensations in the stomach. But if this has been going on for months, first of all, if that started and you kept taking it, you might have been adding more to the burning by still staying on it, okay? And at a point, this is going on for months, and if you've stopped your medicines and it's still going on, it's time to talk to your doctor to see if you can get somebody to take a look down there and figure out what's going on, all right? Burning could be that it was caustic. It literally led to some burning because too much stayed in your stomach and didn't get into the intestines because the capsules you put it in aren't designed to get it into the intestines, versus the product I use is a liposomal oregano and a liposomal cinnamon clove oregano encapsulated in a way that it's supposed to work its way through into the small intestines, okay? And that's a product by doctor-inspired formulations, both of those, all right? So part of your problem is it could have been caustic. Okay, but the other thing is it's also possible that, being on antibiotics and antibacterials and everything else, that you can get too many yeast, for instance, growing up here in the food pipe too. That can give you a lot of sensations. So if this is going on, even if you've been off of this for a month or so, I usually be talking to your doctor. They need to consider whether someone needs to scope into there and see what's going on that's leading to these kind of problems for you. That seems to have been going on for too long to me. Okay. All right. Good luck to you, Elena. Hello, Justin. Anything to help with sleep? I feel like my sleep is exhausting. I understand the body is trying to repair during sleep, but my God, when I wake up, I feel worse, like I've just been in a war, like I actually physically played out my dreams. So, Justin, regarding sleep, I like to have my patients get at least 7 to 9 hours of sleep. The reason I like them to get 7 to 9 hours of sleep is not to make them feel better. I hope they do by getting sleep. I hope they do feel better, but that's not why I want them to get 7 to 9 hours of sleep. The reason I want people to get 7 to 9 hours of sleep is it helps your immune system function better, and getting sleep lowers inflammation cytokines. That's why I want people to get sleep. Also, getting sleep helps pain, okay? But when you have chronic infections like this, getting sleep is not going to energize you. You're not going to start getting better until you get your germ load knocked down and fix the other problems that may be part of this, like mold toxicity or mitochondria dysfunction, all the other things that add together to create this illness, okay? But getting sleep itself is not going to make you feel restored, not until you deal with the underlying problems. All right? All right. Good luck to you. Hello, Dave. Let's see. Happy New Year, and thanks for doing this webinar. You're welcome. In a previous webinar, you make it. Oh, I think I kind of answered this earlier, basically. Okay. All right. Thanks, Dave. Let's see here. Hello, Carter. Let's see. Do you have any suggestions for UTIs or bladder infections, especially in the early phases when there's some tingling or discomfort in the bladder? So Carter, first of all, if you're a male, and with the name Carter, I wonder if you're a male, okay? It's not common for men to get bladder infections. And so this is one of those situations where you need to talk to your primary care doctor to find out why you're getting those kind of sensations, because I'm doubtful it's a bladder infection, okay? All right. And if it is, then you need to figure out why you're getting bladder infections. It's not common for men to get bladder infections. All right. Good luck to you. Hello, Ash. Let's see. Our son is being treated for chronic Lyme. His mitochondrial function has been affected very badly. We have started him on NT-factor energy last 3 weeks. He has shown good improvements. We were wondering if we could give him ATP 360 instead. He's 4 years old. What would be the dosage? All right. So generally, when you look at how to dose kids, if no pharmaceutical company has done the studies, a general rule of thumb is to take a standard adult dose and do a proportion of it based upon his weight. So most of the standard adult doses you can think of as being for a person that's like 170 pounds, for instance, okay? And so a standard adult dose for a 170-pound person on ATP 360 would be 3 pills 1 time a day, okay? Your 4-year-old's probably about 40 pounds, roughly, I said, okay? So you're talking about a quarter. Well, you're gonna have a hard time. Because the ATP, no, actually you can cut those up. I would do anywhere from 1/2. I would probably do about 1/2 to 2/3 of an ATP 360. That just based upon the weight. Okay. All right. All right. But also you probably ought to talk with your doctors to make sure they're involved with that as well too. Okay. All right. Good luck to you. Hello, Mosby. Let's see. Which infection can cause red burning skin in the brachial plexus that is aggravated by heat? I can get out of a hot shower and my left shoulder is red and inflamed, but my right shoulder is not. It appears there's something living there unless it's psoriatic arthritis. Mosby, I don't know. I would need to take a look at you. I wouldn't say that falls into the category of any one of the common infections I see in Lyme and tick-borne infections, okay? All right. Good luck to you. Hello, Sandy. Let's see. Thank you for your webinar. You're welcome. Should I take Trifortify first or cholestyramine first in the evenings? Can I take a biofilm buster at the same time I take a binder, such as Interphase and GI Detox? And number 3, my eyes itch a few times after I take Trifortify. Should I stop taking it? regarding, so again, I'm not your doctor. So these are things you really should be talking to directly to your doctor about, okay? But if I had a person in a similar situation, that burning sensation you're getting after the Trifortify sounds, the fact that it goes away sounds more like it's a temporary side effect. I think if you were my patient, I would say you're probably okay taking that. In terms of taking biofilm busters and binders, it's really hard to do both, mainly because you got timing issues. They should not be taken together, all right? So your biofilm busters are all enzymes. And as an enzyme, they're going to tend to try to digest whatever else is in the stomach with them at the same time, including your binders. And although the binder might still get through, that digestive enzyme is going to be all used up and not get absorbed into your bloodstream to start breaking up biofilms. So no, they should not be taken at the same time. Okay. And then let's see, should I take Trifortify first or cholestyramine first in the evening? So it doesn't matter, but you do have a timing issue, and that is, excuse me. The way that to use cholestyramine is you want to make sure, I tell my patients with cholestyramine to stop other medicines and supplements at least a half hour or more before they take the cholestyramine. And then they can start taking things like medicines and supplements again 2 hours after they take the cholestyramine, okay? So if you're going to do your Trifortify first, you can. Just make sure there's enough time between taking it and when you take your cholestyramine, at least half an hour, okay? All right. Good luck to you, Sandy. All right, everyone. That's it. That's it for me for tonight. It's my first webinar back in the new year. I'm glad to see that we had so many people here tonight, too. I think we had a number of them. Let's see here. Yeah, we had a pretty good turnout. We had a lot of people sign up, a lot more, one of my highest signups in a long time. So good to be with you all here tonight. And for those of you that gave me some wishes and were concerned about me having had COVID, thank you. I appreciate that. But as you can tell, generally I'm doing pretty well, just a little snotty here still. And tired, mostly tired, as you know. So, but that will pass. And if not, I have the tools to fix that up. As I described earlier, there's things I can do, I know, to boost my energy if I need to. Tomorrow morning, keep a lookout in your email, somewhere between 9 and 9:30 in the morning. By 9 or 9:30 in the morning, I should have an email sent to you announcing that the recording is ready to be viewed. In that email also will be the links you can use to sign up for next week's webinar. Okay, so we have one next week. And we have the one the week after that. All right. So I hope to see you there. If you're finding benefits from this, know that others will too. So share that email tomorrow morning. Share the email announcing that the recording is ready, and share that email with others that might want to sign up for next week's webinar as well too. Okay. Appreciate if you'd help me reach as many people as possible so I can keep helping as many people as possible. All right. All right. Good night, everyone.